So, doctor, yours is a case of respiratory system. Can you tell me what are the causes of bronchial breath sounds?
Yes, sir. The normal sound of air passing through the tracheobronchial tree is harsh, loud, and hollow. Something like this. But when this air reaches the normal alveoli, these sounds get dampened and the harshness reduces. This is normally. So now if the alveoli are diseased, like in consolidation or in collapse, then this dampening effect does not occur and the sounds remain harsh even when we auscultate it on the chest. So these are called as bronchial breath sounds.